Hello, Cone Health. Today, I'd like to talk to you all about our new Value-Based Care Institute and what we are doing today around value-based care. And I'd like to introduce you to Dr. Angelo Sinopoli, our new Executive Vice President for Value-Based Care. Dr. Sinopoli is a pulmonologist who specializes in critical care medicine and who has a vast experience in value-based care. Dr. Sinopoli, thank you for being here with me today. I really appreciate it. So when we talk about value-based care at Cone Health, what do we really mean? How do we define it here at Cone Health?
Value-based care is a model of care that emphasizes care to our entire communities as well as individual patients. We prioritize patients' needs, we prioritize their preferences, and we strive to create a model that addresses all of those across the entire continuum and include them in decision-making and redesign of the care that we deliver to them to make it easier and more efficient.
Great. How does that affect cost and how they pay for their care?
So in value-based care, as long as we are identifying the needs and making sure that those needs are getting addressed, what we find is that the clinical outcomes actually dramatically improve, and because of that, the cost goes down.
So we do a better job, we have higher quality, the patient gets what they want and need, and it costs less.
Yes.
Wow.
Yes.
That's a win-win for everybody.
It is. It is.
So we've been doing this for a while at Cone Health, for about 12 years, and that started with our ACO, Triad Health Network, and then we added our Medicare Advantage plan, Health Team Advantage. Cone Health Medical Group has been involved in this for a long time. So how will the Value-Based Care Institute accelerate and improve what we've already been doing for a while?
Well, Cone has a long, rich history of being successful in value-based care already. As you pointed out, for many years, Cone's been a nationally respected value-based network. And I think what this will bring to Cone and to THN is just an increased focus by aggregating all of the assets that have been developed at Cone over the years into a central entity where we can leverage the synergies of all those assets and focus even greater on patient care in our communities. I think we'll see even increased outcomes for the next number of years.
Great. So in places outside of THN or HTA where maybe people haven't been thinking about value-based care, how can they become involved? What can our teammates around the system do to really enhance the work we're doing in value-based care?
Yeah, just so remember that what value-based care is about, it's not about fee-for-service model, it's not about sick care. It is actually about trying to drive health in our communities and trying to improve the outcomes of our patients and communities. And so keeping that patient, just remember the patient is the center of our focus. And so we should always be paying attention to our patients' preferences, their needs, any barriers that they have to care. And our team should be paying particular attention to those and helping us identify those and get patients what they need for the best care they can get.
So what I hear you saying is that as long as we remember that the patient is at the center of everything we do, and we're doing the best thing for the patient who's right in front of us, we're contributing to value-based care.
Absolutely. Absolutely. That is the core of value-based care.
Terrific. Thanks, Angelo.
Thank you.
Hey, and thank you all for listening today. And thank you for what you do every day to keep our patients safe and having great outcomes. Cone Health, it's great to talk with you today. Thank you for all you do.